Hi, I'm David Cohen.
I'm Becky Allen.
We're both students at Shenandoah University studying occupational therapy. And this is an advocacy project for our policy and advocacy class. And the topic we're going to be talking about today is OT's role in home health for Medicare.
Good morning, Representative Cohen.
Nice to meet you. Thanks for coming today.
Thank you for having us. My name is Becky Allen, and I'm an occupational therapy student at Shenandoah University. I'm also a member of the American Occupational Therapy Association.
Okay.
Are you familiar with occupational therapy?
I don't think so, really. To my understanding, occupational therapists help people get jobs. Is that what it is?
Well, we do basically help people with the skills of daily living, which certainly includes working. As OTs, we're medical professionals, and we specialize in working with individuals who are living with other chronic conditions or disability, and to help them to fully participate in all activities of their daily lives, and help them, to do the things that they need to do and they want to do, and to be as independent as possible. We help people with the daily tasks, things like dressing, bathing, being able to make a sandwich, things that, you and I sort of take for granted in our ability to do these without any problem at all. We also work in helping individuals. We work in a variety of different settings. We work in hospitals. We can work in rehabilitation centers. Oftentimes we work in the school setting, and we also work in home health care.
Oh, that's why you're here today, right?
That is why we're here today. We wanted to talk about the Medicare Home Health Flexibility Act, which you may be familiar with. That is H.R. 2468.
Okay.
And this bill is being sponsored by two of your colleagues, Representatives Bustani and Lewis. Are you familiar with this act at all?
I'm actually not, no.
Okay, great. Well, I'd be happy to tell you about it. The purpose of this particular bill is to make OT an initiating service for Medicare home health service. And so what that means, currently occupational therapy isn't listed as a qualifying service. So it's only as a continuing service, which basically limits the effective utilization of OTs in the home health setting, and it prevents the patients from actually getting the most skilled therapy person in there to get them the care that they need.
Okay.
Mm-hmm.
So what does this really mean? Can you kind of translate that for me?
Well, as the way that the law is written right now, if a doctor were to prescribe OT in the home health care to a Medicare recipient, what needs to happen first is that either a nurse, a physical therapist, or a speech language pathologist would need to be the first individual, the therapy professional or rehab professional that a person would be seen in their home, even though that they may not actually need these services. So one of these other healthcare providers would actually need to open up the case. They'd need to go and visit with this person initially prior to occupational therapy being able to come in and perform occupational therapy services with this individual, even though a doctor has prescribed OT.
Okay, so, all right. So if my understanding is correctly, a person might need just OT but not other services, but under the law right now, they can't have that. Is that what it is?
Occupational therapy can't be the only service that's ever prescribed the way that the law is written right now. Typically, what a doctor will write is PT and OT as needed, or therapy. They'll give a general sort of therapy referral.
Okay.
But the way that the law is written right now, even if an individual would benefit more from occupational therapy versus physical therapy, the physical therapist or nurse would have to be the first person that the Medicare recipient sees.
Okay, and is there times where patients don't need, they just need OT, they don't need OT and PT?
There are perhaps instances. The specializations are different. Physical therapy works more on sort of mobility issues and works with a specific limb or the joint that's causing problems for the individual in the home.
Mm-hmm.
An occupational therapist is different. Not only do we work on these types of issues, but where our specialty comes into play is that we look at the interaction. We take a holistic approach, which just means we look at the individual as a whole, and we take into account the individual and the environment that they're operating in, they're living in, and to help to maximize their function and their independence. So what we do, this is a unique skill that we're providing. We examine the interaction of the individual and the environment to help the improving safety and independence in daily living. For example, we can look at safety issues in the house, or we can help provide equipment and train people in the use of these equipment. Things like a shower chair, so somebody doesn't slip and fall, but they're able to independently to be able to take a shower. Things like a long-handled reacher, which would somebody who has maybe limited range of motion, isn't able to move their arm very well, to be able to pick things up off the floor in a safe manner, that kind of thing. But they're still able to go about their day and to be independent.
All right, and this is a role that's primarily OT?
This is what we do.
Oh, okay.
Yeah, that's our unique specialization.
All right, so it sounds to me like this could be a time waster and a money waster. Am I right? Am I seeing that correctly? If a person just needs certain services but not others, but they're required under the law to receive both?
That's exactly right. It's you are having both time and money, these most important resources being probably not as effectively used as possible, simply because you'll go in and you'll have a physical therapist come in first initially, even though maybe physical therapy isn't the best course of action for this particular individual. So the important thing about this legislation to keep in mind as well is that not only does it help the patients get the most appropriate care that they need, but it's also sort of a cost-neutral endeavor, because it doesn't expand Medicare eligibility or services, but it just improves the flexibility in using the most appropriate skilled therapists to be able to open the cases up. So we're not, increasing the amount of coverage or services that individuals under Medicare are receiving. It's just that we're making sure that they're able to see the people that they need to see in the most effective manner as possible. Kind of sort of cutting out these extra steps that cost time and they cost money, and they're able to see the occupational therapist as indicated by the doctor in the doctor's orders, and they're able to see them first.
I think that's especially important today when the economy is so bad and you can't really pass much through the Congress that allocates a lot of money or additional spending. So that's an important fact.
Yeah, and that's definitely something that is very important for this particular bill. That it's not going to be. It actually may be in the end a cost savings for Medicare in general, because you're going to have the right allocation of resources to the right people.
All right.
Okay.
Thank you.
So I wanted to leave you with a fact sheet that we've prepared for you on this particular issue. Our contact information is at the bottom, so if you have any follow-up questions from you or your staff, we'd be happy to talk with you further about it. So we want to thank you for your time, and we also hope that we can count on your vote to support this important issue.
Oh, I really appreciate you coming in, and I've learned a lot through this session, and I'll definitely investigate this further.
Great. Thank you very much.
Thank you.